A very big hello to you. You are welcome back to my YouTube channel. It's been really long. It's been a year since we last had a conversation here. Thank you very much for hanging in here, my dear subscribers, family. Thank you for the encouragement. Thank you for the comments. Thank you for the reminders that you kept sending in. And thank you for the consultations that you kept bringing in off here to ensure that I'm of help to you. So, welcome back to Nutrition Care with Gloria, and here we have nutrition talks, nutrition education to step up our nutrition and make sure that we are healthy, because we know that nutrition is the backbone of health. I'm glad to have you here, and let's dive right in. Today I'm going to talk about something very brief, but it's something that I've had a number of consultations about, and people have a lot of myths around it. And I would like to talk about just the basics. I'm here to talk about the basics of nutrition care during pregnancy. There are a number of myths around pregnancy. Everyone has something to say about someone who is pregnant, about your baby, about what to expect, about what to eat, about what your health is going to be like. And sometimes it can be very, very overwhelming, especially when it comes to diet and how to make sure that you're fit, that you have the right nutrition status even when you are pregnant. So I'm here to debunk a few myths and also give us a few basics for the mothers to be, for those who are already mothers, for those who have questions around it. Here we are to talk about it. So there is no one size fits all for pregnant women. That when you're pregnant, you should expect this, and it has to be for everyone. That when you're pregnant, you should eat this. Even if you vomit, even if you should eat this, it should be for everyone. There is no one size fits all, because like I always say, our bodies are very different and they respond differently to sickness, to health, and even to pregnancy. So it's important that you know that you are different, and for the changes that come with pregnancy, you can consult with your obstetrician, you can consult with a nutritionist, with your gynecologist, with whoever medical practitioner that you are dealing with. Make sure you consult with them so that they guide you through. That's why it is important for you to go for all your antenatal visits, and not to only sit there and converse with your fellow women who have ever been pregnant. Well, I know it's good that experience teaches, but it's not holistic. It's not that we get all our knowledge from experiences. So it's important that you consult with your doctor. The first myth that I want to talk about is eating for two, that when you are pregnant, you should eat for two. I've seen a number of women that from the time that they discover that they are pregnant, they start eating much more than they've been eating, and before you know it, they're gaining a lot of weight, but they want to make it feel okay because they have been told that when you're pregnant, you're eating for two. Well, it's true that there is another whole human being growing in your body, but it's not true that you should start eating for two, because this human being is not really eating your food directly. It's not like if you're eating one banana, if you eat two, one is for the baby. No, that is really a myth. In the first trimester of pregnancy, you do not actually need any extra calories. You don't need any extra calories. You just need the right nutrients, and normally it's folic acid for the development of the baby and all the vital parts that are being formed in the first trimester. So it's only in the second trimester where your calories can be stepped up by 300 to 340, and then in the third trimester, which is the last trimester of pregnancy, your calories can be stepped up to 400 and above. So it is important for you to know that this baby that is growing in your womb is not yet a whole human being like you right from the time you conceive. So what does this mean? This baby needs to be formed the normal way. Do not starve yourself. Well, do not starve yourself, but also do not start eating 2 plates or more of food because you are pregnant. I think you should concentrate more on stepping up your nutrient intake than your quantity of food. You can step up your quality of food and not your quantity of food, so that the baby gets the right nutrients for their body parts to form the normal way. So in the first trimester of pregnancy, eat normally, just be intentional. Eat a balanced diet. We talked about the eat well plate. Give your baby enough nutrients. You don't need to step up the quantity of food. You can eat the same food. And then in the second trimester, you will actually feel like your body demands are increasing a bit. So you can step up your intake. You can put in more snacks in between your main 3 meals of the day, but make sure that these snacks are nutrient dense for your baby. And then in the third trimester, the child is actually putting on weight. Most of the body parts are formed. So here you need to be extra careful. I'm not meaning you should starve yourself in the third trimester, but consider having a diet that will keep your baby in the right weight check, and even you yourself as a mother, because you do not want to struggle with obesity. You do not want to struggle with diabetes and pre-diabetes, and even expose your baby to a number of dangers that come with overfeeding. So be cautious about this. And the second myth that I want to talk about that people think should happen during pregnancy is weight. People think that for as long as you are pregnant, you need to gain a lot of weight. Well, that is not true. And I've seen people ask me, and I've actually seen some do it. They overeat so that they put on a lot of weight, because it is known that if you are to be healthy and pregnant, you should be fat, you should be big. But that's not true. Still, I'll say that our bodies are very different, and I'll emphasize what I've just talked about in the previous myth. Concentrate more on the nutrients instead of the numbers. Obviously, pregnancy is not the time for you to start a crash diet. It's not the time for you to start a bland diet. It's not the time for you to start intermittent fasting to manage your weight. No, but make sure that you're taking in enough nutrients for your baby, enough protein intake for your baby's formation. Take your folic acid, take your vitamins, everything that you've been given or advised by the doctor. Make sure you take it. And don't mind about the weight so much, because some people gain so much weight which they shed off after pregnancy. Others do not put on a lot of weight, and that should be okay. Do not compare yourself with another. Our bodies are different, our genes are different. So make sure that weight is not a very big worry for you during pregnancy, because you don't want to hurt your baby or give birth to an abnormal child just because you were managing your weight, or because you were choosing to overeat so that you should gain weight. Concentrate more on the nutrients than the numbers. The third thing that I want to talk about is exercise. I don't know how much to emphasize the fact that pregnancy is not a disease. Pregnancy is not an abnormality. Pregnancy is not an abnormal situation. It is just a condition which is normal, and it's a phase, it's a season which ends. If you are carrying a normal pregnancy and you've consulted with your doctor and they prescribe for you exercise, please go for it. I don't mean start carrying weights of 100 kilograms. You will hurt yourself. But feel free to go for those walks. Feel free to jog around. This will help you to feel alive. Pregnancy can come. The hormones of pregnancy are very intense. You can feel fatigued. You can feel like you don't have life within you. So these exercises alone will make you feel alive. They will rejuvenate you. They will give you the energy for people that struggle with fatigue, and they will keep your weight in check. They will step up your appetite. Yes, some people struggle to eat during pregnancy. So you can incorporate a bit of exercise in your pregnancy journey. You can consult with your doctor. They'll prescribe the right exercises for you. Your nutritionist, there is nutrition care during pregnancy, and it has the sport bit of it. You can consult with them and they'll prescribe for you the right thing. Your physiotherapist. Obviously, when you're pregnant, you don't do every exercise that every other normal person does. So it's important that you get the right prescription. And do not be hard on yourself. Do not be hard on yourself. Do what you can. If what is prescribed you can't, please work with your health worker to make sure that you get the right prescription and what suits you and what you are able to do. But this only applies to people who have actually a very normal pregnancy, no risk factors. No, you're not struggling with any underlying condition with your pregnancy. If you are, please be careful. Some people are actually advised to take a complete bed rest throughout their pregnancy, and that should be okay. When your child comes, you will be able to work around your body. But if you are normal, exercise is not a taboo. Some people are told, don't bend, don't touch here, don't do this. No, it doesn't mean that you should be sedentary because you're pregnant. You are not lame, you're not disabled. You are just happy and expecting a child, and there are things that you can still do and keep fit. So those are the main 3 things that I wanted to talk about. The other things rotate around eating. Do not take caffeine, do not take alcohol, do not take water. Well, it's safer for you to take the right things during pregnancy. I'm not saying that there are right things and wrong things that during pregnancy, but it's fair and kind enough of you to take enough water during pregnancy. If you can avoid caffeine, please do. And if you can't, please take it like in minimal amounts, because it may step up your heartbeat. Before you know it, you have palpitations, depending on how you were by the previously before conceiving. And now that you have conceived, you can still take your caffeine, but in minimal and limited amounts. Just make sure that you're taking a lot of water. You don't want to struggle with constipation during pregnancy. You don't want to struggle with dehydration during pregnancy. Pregnancy alone has its challenges, so be kind enough to yourself, take in enough water, and be happy. Expect good. Even as you are getting advice from your nutritionist or your health worker, it all starts with the mindset. What mindset are you coming with to start your pregnancy journey? It's important that you come with a very, very positive mindset. It all starts with the brain. So as much as you can, please take the water, take in the fluids, be kind to yourself, take in the snacks. If this food fails, try another. If you're struggling with spicy food, try bland diets. For as long as the right nutrients are incorporated in there, it is very okay, because your maternal diet determines the outcome. The nutrients that you take during pregnancy determine the kind of baby that you're going to give birth to. They determine their brain development, determines their physical development. You don't want to give birth to an abnormal child. So since food and nutrition builds up, is the backbone of health and gives the right building blocks for life, it is the same even during pregnancy. So good nutrition nourishes the body and prepares you for delivery. If you eat well, you have enough energy, obviously you are looking at delivering your baby normally, depending on your state, or if there is no underlying condition. And also another thing that I want to talk about is that pregnancy comes with craving hormones, or estrogen and progesterone. Your cravings are not going to be the same with the other mother. Your cravings can be intense. Others cravings are very mild. But if you crave for something and it's healthy, please, if you're able to get it and eat it. Do not be hard on yourself. And foods with too much mercury, especially fish, there are kinds of fish that have too much mercury, should be avoided during pregnancy. Yes, that is also an advice for you. The same way I've talked about caffeine, and also foods with too much mercury should be avoided. I'm not saying do not eat fish. Tilapia is okay, but there are those kinds of fish that are exposed to too much mercury and may not be very good for your health during pregnancy. So it's not that everything that you feel like eating in pregnancy you should eat. It's not like if you feel like taking 4 glasses of alcohol, you should take them. No, the cravings will be there. You are not abnormal, but only eat the right things. Be fair to yourself and be fair to your child, and know that this phase will pass. So your weight, your nutrient intake, your mental health are very, very important during pregnancy. The myths that we've been able to talk about, please ensure that you work on your mind around them. And if you have any questions, please feel free to put them in the comment section. I'll be willing to answer them. And if you have any comments, anything that you'd like me to talk about more about pregnancy, please feel free to reach out in the comment section, and I'll be responding to those questions. I'll be responding to those comments, and let's keep it going. And if there is anything that you'd like me to talk about more here on, please also mention it in the comment section, and we shall be talking about it. Otherwise, it's been nice having you here. For all the pregnant mothers and expecting mothers, I wish you all the best. You can do it. Your body can do it. Your mind can handle that season. Go through the challenges of pregnancy with kindness, and if it's a normal pregnancy, kudos to you. Kudos to you, really. Have a great time. See you when we get back. Bye-bye.